Hello, I'm really excited to give you guys an update on how I'm doing with the left side of my face now. I've been treating the right side for about a week with the DopaLights, with these little red and different colored lights. And now I'm working on the left side to even it out with the right side because there was starting to be quite a noticeable difference. And already I'm seeing a big change in the left side. So I wanted to just show you guys that and point out a few things right quick that I've discovered. I think that the facial nerve is a really big part of the great results I'm getting. And I think I accidentally happened onto that on the right side because I have these little spider veins here. So I was automatically targeting this area right through here, which is right where the buccal branch of the facial nerve runs. And the main thing I noticed was this big lift in this side of my face, that it was all droopy around my mouth and it just like lifted up like it had a facelift. And so I started looking into that, and the facial nerve actually runs in branches. One branch goes right down through here where we see a lot of signs of aging, these jowls right through here. Another branch, all the branches start right around the ears here, right in front of your ear. I don't know if you can see that, right in front there. And then the buccal branch comes down here, and then it goes, one part goes under the lip and one part goes over the lip. Okay, but the main one goes right through there under your cheek, from your ear to your mouth. And that's a huge area of concern with aging. You get this droopy, puffy stuff all around through here. And then another one goes right up through the nose here. And you see some drooping through there sometimes. And I have to say here, you really should wear goggles, protective eyewear, if you go anywhere near your eyes. But I'm going to show you now because I don't have my goggles yet. I've ordered them, but they haven't come in. But if you close your eye, you'll probably be okay. But really, the goggles are recommended. Because this is a very bright light, and you certainly don't want to have that go right into your eyes. Now, if you go, another branch of the facial nerve goes right under your eye, okay, and then back down to the ear. All of them start right in here, and this is a good area to work just to get all of them. And then it goes over the eye, which we see a lot of difference between my before and after in that area. And then one goes right up here over their forehead, and it kind of branches right into where we have these lines. Isn't that interesting? And goes right through here where we sometimes get lines also. Okay, and then back into the start of it there. Now, if you see the video from a couple of days ago with the left side of my face, you see it was much more droopy through here. Now it's really been lifted quite a bit, and those lines are smaller, and the puffiness and sagginess is much better. It's much more even on both sides. You see that over here? There was like a big bump through there. It's gone. They're pretty much gone. I still could work on it a little more, but really amazing results in such a short amount of time. Still got a little bit of lines through here. I need to work on that some more, but it's better than it was. I'd say overall already noticeably better than it was. And this area is just amazing what that's done so quickly. So I just couldn't wait to go ahead and show you guys, because I think it's really something. And the facial nerve is important for many other things also. We really need to decrease the inflammation on that nerve, and the light therapy is known to decrease inflammation. Anywhere you put it, if you have pain or inflammation, you can treat it with light therapy, and it helps the swelling go down, helps the pain. And so it makes sense that using that on your facial nerve would be helpful. And when the facial nerve works correctly, it keeps everything nice and tight, and it helps you with your expressions. I know a lot of people with Parkinson's have trouble getting their facial expressions to work correctly, and the facial nerve is what controls that. So it's a good idea. If you have in your red light bracelet, if you have one of the wristbands from DopaLights, you can just take this out. This is just the little light piece that's in the wristband. You can take it out and just use it like I'm using it here. You have to put it on the constant light setting, and you just use it like that. Okay.